Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Ta-da! Here we are again.
Hello, everyone. Welcome to the Soft Bites podcast. Hello, Andre. How are you?
How are you, Manuela?
I'm good.
It seems like whenever I don't talk to you for more than 1 week, I feel there's something strange going on. And when I get back to you, I feel that I'm back on track again.
So we were talking before we start recording, and you were telling me that you've been doing a lot of traveling.
Yes, I was doing a lot. I've been over the last 2 months. I've been in a few courses. I've been in India 1 week. I've been in Spain. I've been in France. I've been traveling quite a lot. And I was telling you that my next trip will be to Ibiza in maybe a month or so. But these weeks, actually, this month and this almost 2 months that I'm going to stay here only in Espinho, I'm enjoying just surfing, going to bed early, not going out, not drinking alcohol. It's feeling good. So
Some say that the best.
I have a very unique, very constant routine now, actually. And
Some people say that one of the best parts of traveling is also
coming back.
returning home.
Yeah. But it really felt good for me because it was difficult, and we've been also together in a course in Lisbon, and I drove to Lisbon in 6 a.m. in the morning. I went to meet the dentist there. Then I went to John Borges. Then I came back in the same day. Then the following days I went to India, and in between I was giving my course that I usually give, my ongoing course, and it was a few months that were difficult, and all because this COVID thing, it just crushed everything. All the courses got delayed, and but I'm enjoying staying at home and having this boring routine, but I'm enjoying it.
I feel the same. I like to have things planned. I like to know, and sometimes it's like you said, it's one thing, then the other. Then you stay one day in a place, and then you have to take a train and then airplane. And I also have that. Actually, this morning I arrived from the Pyrenees, from the south of France, to Brussels. Tomorrow I'm traveling to Holland. I have to catch 2 trains to Holland. Then on Friday I'm giving a course during the day in a clinic, and then in the end of the day I travel back by train into Antwerp, and I'm catching back another plane on Sunday. So I have everything well planned.
Yes.
But then I like to have a space for where I can stay at home and recover, and having that boring routine, like you said. But it's not boring. It's when you really also planned your time ahead in the more busy time, but you have time also to think about things, to plan things, and to really recover from all of that. But for me, the secret is good planning. I like to have things well.
You have to schedule
planned.
everything. You have to schedule everything, and you have to Google Calendar is just a miracle, isn't it? Gmail, Google Calendar, and Google Tasks. Those are the things that I use the most.
Also, something that I think it was with Jasper that we talked on the other episode with him, that we said that also saying
no.
Saying no. So only saying yes to things that you really feel that you're going to enjoy doing, and that you're going to enjoy prepared yourself to do it, because it requires a lot of energy. It requires a lot of yourself. So if you are doing this and going to places that you really don't want to, or really don't feel like be there, then it makes everything much difficult.
One of the things that being single is very good for me is that most people don't invite me for weddings, which is amazing, because I think most of the weddings are really boring. So that's one of the things that I really don't even bother of saying no, because I think that people, oh, he's a single guy, makes no sense bringing him to a wedding. So it's amazing. Well, the very few that have the courage to invite me are really people that very close friends. But I I had two weddings this year. One of my cousin in Brazil, which I'll be going in August. Another one of Paulo Carvalho, which is a colleague of mine. Those were I could not say no to those, and I would enjoy that. But the good thing is that it's good. It's no one invites me for weddings, and I like that, because I find that most of the weddings are really boring parties with with some boring activities. So I love that. I don't have to say no, but I have said no to quite a lot of weddings in the past. I said no because I don't like it.
I actually don't remember.
I tell them, look, I'm happy. I'm happy. Yes, I'm happy for you. I'll be more than happy to help you in any way, and I hope that everything goes okay. But just don't place me 3 hours in a table of 6 people that I don't know sometimes, and talking about some random and waiting for food that's most of the times I don't even like.
Okay, next time someone asks you to invite you to a wedding, you say, okay, go listen to my podcast episode here. I explain this.
No, they don't even invite me, actually. They don't even invite me. Actually, I went to a wedding a few weeks ago, but it was a very small one and a very cozy wedding, and it was good. But the typical wedding, please don't invite me, please.
Yeah, I was telling you, I don't know the last time I've been in a wedding. I actually don't remember. It's not my, but maybe the I don't know. This would be another discussion, but maybe
Yes.
the traditional. I think it's outdated, like the traditional party of weddings. But maybe I'm.
Yes.
Some people might feel offended.
Absolutely,
I'm saying,
absolutely.
Yeah.
We have to. But I think respect comes both ways. You have to respect also people that find that the weddings are just. This is the feeling that I have. They do it because, of course, they want to have. Sometimes they want to have but they want to have a party with every people. But I think that there's a lot of showing off. There's a lot of tradition.
It's like the party is more for to show something to others than for the.
And again, I agree with you. We may be being naughty here, but I mean, it's just that's what I feel. I mean, that's
but it's like we're saying, it's not for us. It's not something that we will enjoy. So just say no, thank you. And if it's someone that you really like and that you really feel that you're going to have a good time and that you're going to enjoy, then say yes.
And advice, please make your adding more customized to yourself. Don't do what everybody else does.
True.
Don't do the same old thing that everybody does, please. It's your marriage. It's your marriage, right?
Okay, so today we're going to talk about something that we said that on the last episode that we were going to continue. So we're going to talk about emotional intelligence in dentistry. I sometimes refer to it as emotional intelligence, others other times to emotional awareness, but it's actually the same thing. So basically, emotional intelligence or emotional awareness is the ability to monitor our own feelings and emotions, and to be able to notice them, to be able to discriminate among our emotions, and also to use this information to guide our actions. So and this is based on self-awareness, and self-awareness is based on mindfulness, on paying attention. So this is something. Emotional intelligence is actually a skill that we can develop if we learn mindfulness.
Mm-hmm.
But this is very interesting because, and one of the things that I observed when I started teaching mindfulness to dentists, and that I actually also observed within myself when I start learning mindfulness myself, is that in general we have no self-awareness of our emotions while we are working, and of course, this is due to the fact that we have a lot going on while we are working, right? So we have a highly demanding, skillful work, technical skill work that we need to do in a short amount of time, and we are doing that work in a person's mouth. We are doing it usually with someone else next to us helping us, and there is a lot going on in that environment. So sometimes we don't have time to pay attention to what's going on in ourselves. But during the technical work, when we are in the chair, when the patient is with their mouth open, that's actually the easy part. So it's very easy for us as dentists to enter the flow channel, and we are executing what we learned.
Yeah.
I think that emotional awareness is more useful for dentists, and it's more difficult also when the patient is with the with the mouth shut. I mean, we are not working
So
inside
basically,
his mouth.
what you are saying is that he's capable of speaking, right?
Yeah, that's it. That's it. When the patient
That's
is
when you have to be
capable
afraid.
of thinking.
While he's
Yeah, that's it.
while he can't use his mouth, you are okay.
That-
Once he's able to use it, then you have to watch out.
That's it. That's exactly it. So I think that, and this is a big thing about stress reduction in dentistry. So emotional awareness is crucial for stress reduction in dentistry. That dentists don't realize that part of the main part of the stress is not the patient, is the way that they react to the
Yes,
patient.
it's themselves.
Yeah.
So, Mama,
Yeah.
but before you continue, let me just,
Yeah.
because sometimes I'm also like I told you, whenever you talk about emotions, you are way more developed than I am. I'm a learner. I'm an apprenticeship in emotions. But so, can you talked about mindfulness? Can you shortly describe what is mindfulness? What is emotional awareness, and what is awareness? So what is mindfulness? What is awareness? What's the big distinction here?
So mindfulness is the ability that it's a skill, but it's the ability to paying attention in an intentional way to the present moment in a non-judgmental way.
Okay.
So basically, you are in the present moment. So
Not judging what's going on.
Not judging what's going on. So you create a body-mind connection.
Okay.
Right? So usually half of the time, there are studies that say 47% of our time we are not we are not mindful. So our body is
Connected.
doing something, right? So it's performing a task, usually a routine task, and we enter in the autopilot
Which is
mode.
the flow, what people call the flow state.
It's a little bit different, because for you to reach the flow, imagine, let's put the example when we are in the chair working in the patient's mouth.
Okay.
If you are mindful, then you are totally focused and present in what you are doing. So you use your senses, and you connect your body and mind.
Yes, you are not thinking. You are not thinking.
Yeah, so that is crucial for you to enter in the zone, for you to reach the flow channel, right? According to the flow theory.
Okay.
If you are an automatic pilot, then you are completely disconnected. So you are working, but your mind is
elsewhere.
Yes, your mind is thinking about the patient before that didn't go according to what you were wanted, or the patient that you are going to have next, that it's going to be difficult and you are already late. So you are disconnected.
Today I had one. It was, sorry to interrupt, but today in the morning, I was really, really happy with my day. I was really, really happy with my life. I was like, look, I'm here. I love dentistry. This is so cool. I'm coming back to see the patients. I've been away for 2 months. I have such an amazing team. I love doing this. I love every detail of dentistry. Then in the afternoon,
something happened.
Yes. Emergencies. We had I don't usually see that much patients a day. I had booked 4 patients, but I saw maybe twice than that. And at the end of the day, one of the guy I placed 4 implants 4 months ago, not on 4, and he lost. Today I found out he's starting to get it loose. He lost 3 of the 4 implants. So this is a guy that paid $6,000, 6,000 euros a few months ago, placed the implants, and I had to tell him, look, you are now going home without any lower teeth, and we'll have to do a removable denture for you to wear for about 3 months. That really took me completely out of the mindset that I had in the morning, completely. Also, this is an extreme example, but this happened today. But going back to, and of course, I was about to tell you that being mindful is basically the opposite of being on autopilot, right? But there's an even worse state, which is being stressed, being triggered, which is what happened to me today. But before you go on, so you have mindfulness, which is the opposite of autopilot, let's say. Where does awareness come there? What is awareness?
Awareness is the ability to know and to be aware, of course, of our own internal states, of our own preferences, of our own resources, and our own intuitions.
But that's a thought process. That's something that involves thought.
That is self-awareness. And if you join to that the awareness of the surroundings, of the environment surrounding you, right, and everything that is in the environment that surrounds you, then that's awareness.
Okay, so awareness is basically focus on something that's going on either outside or inside.
Or inside yourself.
Right?
Yeah, that's it. And emotional awareness is part of that self-awareness. So only if you have the ability to be mindful, so to be focused, to create that mind-body connection, you can then reach the state of awareness.
So basically,
if you are completely disconnected, if you just live inside of your mind, completely disconnect of your body, you cannot develop self-awareness. You cannot. You don't have any connection with yourself, with what's going on in yourself, especially with emotions, because emotions express first in our body. So if we are completely disconnected from our body, we have no idea of what's going on.
So let me see because I always like to structure things, Which is, okay, so mindfulness is something that basically you are here in the present moment, connected to your body. You have this mind-body connection. So you are Okay.
Yeah, and mindfulness is rooted in the body.
In the body.
So it's
okay.
a practice
Yes.
that it's rooted in the body and in your senses.
Okay.
And that's why when you start a mindfulness practice or a mindfulness program, any kind of program, you always start with body awareness.
Okay.
You always start with the basic meditation, which is the body scan, which is for you to start growing body awareness.
Okay. Yeah, but now you are talking about awareness, right? So do you need awareness to be able to be mindful, or do you need to be mindful to be able to be aware?
You need to be mindful to be able to develop awareness.
Awareness. So awareness is basically a more developed state, is that it?
Yeah, that's it. That's it. That's why with any mindfulness training, you always start, like I was saying, first with body awareness.
Yes.
And then with focused attention.
Yes.
And only after you train these two, then you can start training the open awareness. Then you can start training to be aware of your thoughts, to be aware of your emotions, to be aware of your internal states, of your intuitions, of your gut feelings, of your body wisdom. So only after you are already familiar with your body and already be able to recognize your body and your body sensations, and only after you already have some training also in focused attention. And this, of course, when I mean training, mental training, it's meditation. You can call it mental training, you can call it meditation, but it's basically you have to train it, because this is not something that we are used to do in a daily basis. Usually we are distracted, right? Usually we are especially in routine, which is a big part of our day. And nothing against the autopilot mode, because it's there to save energy, it's there to make our life easier, of course, but we have to be able to be the ones deciding when it's useful for us to enter in the autopilot mode, or when we need to pay attention and to be aware and to be in the moment.
And where does emotional awareness come into the game?
That's it. Which game are you talking about?
So basically, when you're talking about awareness, one of the parts is emotions. So being aware of your emotions.
Yeah. So emotional awareness come when you start practicing the open awareness. Open awareness is a kind of mental training, is a kind of meditation where you train yourself to just notice whatever it's going on. Part of what's going on, it's feelings, it's emotions, and you start to identify, and you start to realize not only emotions, you notice them, you label them, you give them a name, and you anchor them into your body. For example, if there is anxiety, there might be like a knot in the chest. For me, it's in the throat. My throat shuts down. So you start to notice where your emotions express themselves in your body. So that's what you train in the formal practice. So that's part of the training. But then the real power and the real transformation of emotional awareness on our daily basis is that it enables us to bring the pause. You know, that pause that can make all the difference between us reacting, and if we can bring the pause and to respond in a wiser way, to take control of the situation. That's the power of
because
of
you were
emotional
aware
awareness.
of that, because you could be aware of that.
Yeah. But that pause, it's not easy.
Yes, I was about to say that.
No. It's not easy to achieve, and it requires a lot of training, a lot of First, I always say that the first step is always
Meditation.
awareness, isn't it? Yeah, the first step is always meditation, because you need to bring the awareness. You need to develop. But it's it's the first experiences are always you noticing the reaction. It's always you after saying, I reacted, but okay, you're already aware that you
It's too late.
reacted. Yeah, but it's awareness right there, because before we just react and we continue, and okay, another and another, and we reach the end of the day just having no control of what's going on. So when we start noticing the reaction, that's already a first step. That's already a first step. And there will be one day that you can bring the pause before you react, and you can bring a wiser response.
Yeah.
Yeah, because it's just like you said that your day was today, right? I mean, most days of the ones that are listening to us, probably they identify themselves with what you just described that your afternoon was.
Yeah.
Even if they, just like you said, even you started your day feeling great and saying, I love this, I love my team, I love what I do, and then there's a lot of things happening in the
Yeah.
dental clinic, and everything
Yeah.
changes.
Yeah.
And most of the days are spent in automatic pilot. And also because there's a lot of work in dentistry that it's routine. So the technical part, if you begin to feel comfortable, and if you put yourself in a situation that there is no challenge, then you spend most of your day in automatic pilot in dentistry. And then that's when you start to feel disconnected, and then that's when you start to feel that you have absolutely no meaning in what you are doing, and also sometimes no control, because there's going to be a lot of those situations that you just said, and you just react. So it's just like you have no control in what you are doing. So the emotional awareness, and not only the emotional awareness, but the broader awareness of what's going on how you spend your days, what you are reacting, if you are doing things that bring you energy, or if drained you, what are your triggers, and so on. So all of that, it requires work, and it requires you to make the effort to pay attention to what's going on during your days. But if you do that work, then you can make the changes. Also, not only you can start to bring the pause, that's stopping from
Yes.
reacting, but to respond, but also it can enable you to make the small changes that we've been talking
On the
about,
outside
right?
world, on your routine, on your habits, on saying no,
Yeah,
on having systems, on
yeah,
having protocols,
yeah,
exactly to prevent this
yeah.
sort of
That's
stuff.
it. That's it. The small actions, like having the right amount of time for the appointments,
Yeah.
like making
I have to
sure
say,
that you
sorry
are.
to interrupt. I have to
Yeah.
say that this
Mm-hmm.
this is like I don't remember having a day like this for a couple of years. This was like, because we had staff on vacation, we have doctors on vacation. So yes, but I kept reminding myself, look, this is an exception. It's not a typical day. This is happening
Mm-hmm.
because this is happening.
And
And
okay.
also another thing that I was, especially when I finished the work, and I was telling myself, was just like, okay, yes, this guy, we've done dozens and dozens of all on fours and all on six, and our success rate is pretty high. This happened to this guy, okay, no big deal. Let's see what's going on. We have to be honest with the guy. Look, this is going to be difficult for a couple of months. We cannot do immediate loading again. You'll have to wear a denture for a couple of months. Let's see what's going on with your health. And I mean, there's always a solution to a problem, even if the solution is not a good one for the patient. it's just what it is, isn't it? Because at the end of the day, this is a health specialty, right? And health is not mathematics. Health is not predictable. So sometimes bad things happen. And what's the bad part? Yes, you'll have to have a removable denture. Yes, but it's not a serious disease. So you have to also place things into perspective, right? That was the one thing. But interesting, another thing that stressed me, you know what it was? Is because we had a patient with an emergency that it was supposed to took 15 minutes, but it took me 1 hour. So I got to delay 1 hour for every new patient, and we kept calling them to delay them. But then at the end of the day, what really stressed me the most is to realize that my nurses, my assistants, they were there 1 more hour than what was usual. And that for me stressed me even more than the thing with the guy. But because the thing with the guy is something, and see if this makes sense to you. What happened with the guy that lost 3 implants was very bad, but it was not in my control.
Okay.
That's biology. But having my dental nurses getting out of the practice 1 hour later, I can do better eventually. I could do better. I mean, there must be a way. So what would that way be? I paid them incentives, right? But one of the things that I was thinking about was like, okay, so if they work extra hours, why don't they note them? And at the end of the month, I pay them the extra hours. That small system will probably reduce my stress even for them, because they know, yes, they are there 1 more hour, but they will be paid for that. Do you understand? So I usually pay incentives, and I assume that one day or the other this may happen. But I think it would make much more sense if this was quantified. Does it make sense to you?
Yeah, it makes sense.
It's exactly what you said. So if this is happening, you are aware of what's going on. I came home, I was aware of what's going on. Okay, so let's find a system. Well, what about the guy? Yes, I cannot do anything for that. I've done my best. This is biology, this is healthcare, and these things happen. So I think that an extreme example of this can be a doctor that loses a patient, right? So you have to deal with that, which is not even close to that what we feel in dentistry. But for us, it can be really something excruciating, because you placed this guy, he got out of the surgery with fixed teeth the same day, and 3 months later I have to tell him, look, you are going to use a removable denture, which you never use. So this for us is like a huge loss. But I think we have to place things into perspective, right? These things happen, and you have to be aware of that. You lose implants, some things break, people are bruxers, sometimes they don't use the recommendation that we do, they don't have good levels of vitamin D, their lipidic profile is not good, and we know this has connection with implants and stuff like that. So it's not in our control, right? But what you said is very important. So you are aware of what's going on. So what is the system that you are going to apply to be able to reduce the stress of everybody when there's these sorts of days? The stress for them and the stress from, yes, they are leaving late, but they will have 1 extra hour as well. Does it make sense to you?
Yeah, it makes sense. You said a lot of things that I was taking notes, but it totally makes sense. One of the benefits of having that awareness, of having that emotional awareness, is for you to take action.
Yes.
On
to prevent it,
because emotions are information. Yes. And that's what we need to understand. Emotions are valuable information, because I don't know, in our society, Antonio Damasio says this. Yes. In his books, that it's like we don't value emotions. It's like we have no significance for them, but they have a purpose,
and they are essential in decisions.
That's exactly it. And one of the benefits of emotions is this. So if you don't, if you feel, if you identify stress, if you, in the end of the day, you can look at the situation and how you are feeling, then you can take aligned action. So in a way that next time when it happens, and we know that in dentistry, just like you said, there are things that cannot be controlled, but when next time that happens, you already have things into place to deal better. And there are parts that you cannot control, but the part that you can control, then you can take actions. But you have to have the ability to be aware, and also just like you said, to be able to stop and analyze what happened. Analyze
Yeah, but
what
I
happened.
was aware of that. I was aware that I didn't like the climate in the clinic on that last hour. I mean, they were not complaining or bitching or anything, but I mean, they were tired, you know. One of the things that I implemented for them not to get out so late a couple of months ago was they would usually do like a very small cleaning of the clinic at the end of the day, but they would lose half an hour. So I hired an external cleaning company to go there every day and do the cleaning, which enabled them to go home 30 minutes before, which is good. But these sort of situations, I think they should be paid extra. If they leave 1 hour after because they usually leave at 7, but they left at 8, which is 1 hour more. So I'm thinking about maybe doing this extra stuff.
Yeah. So just, and I want to take something else that you said, but before that, because it comes in context, emotional awareness or emotional intelligence benefits. Emotions are necessary for decision making. So that's very important. Emotions contain information. Basically, emotions are information, and emotional awareness enables perspective shift. So you also mentioned that. You have to use, also said that, but you have to put things into perspective. And that takes me to the other part that I wanted there. It was very interesting that you said about the part of the patient that you cannot control, and that you have to be able to put things in perspective and to be able to see, I did my best. This is biology. I cannot control it. Because this is one of the things that it's dangerous in dentistry, is that we confuse the job with our own value. And because there is a component that you cannot control, if you do that every time that situation that you have happens, or every time there's a case of orthodontics that doesn't go that well, or every time that's an endo that fails, or then you feel your own value, it's failing also. That you're failing also as a person and as a professional, and that's dangerous, and that's very heavy.
For me, it was not that much, because it was not that much about me, but I understand that it was quite a lot about a patient that bought this service. I won't say it's a service, which so even me as a dentist, I'm saying it's not service. I mean, he bought this healthcare service, right? That was sold to him as fix teeth in 1 day. Of course, that we always have the informed consents and stuff like that. But it never crosses your mind that these things can happen when you sell a 6,000 or 10,000 or 20 or 15,000 treatment plan. But it happened. You know, you lost 3 implants. In some patients, this was actually a good patient, but in some patients, this might be a disaster. You know, and you have to be able to get yourself grounded and tell them, look, this is what it is. You will not leave today here with teeth. I understand this is disappointing, but this is health, right? This is not math, so these things can happen. If you lost 3 implants, that replaced you, there's maybe something not right. We have to look at we have to do some tests and some exams. Look at your cholesterol, look at your vitamin D, look at your immunology. Let's see what's going on, because this is not common at all. So if we lose one implant, that's one thing, but to lose three, there's something that we need to see exactly what is going on, because this is something that is not normal, and you'll have to be 3 months without your teeth. I'm sorry about that, but that's the safest way to go. I'm going to do a removable denture. We have still one implant, which is going to hold it more or less, but it's danger. I cannot rely on this implant to because we may damage it. But yes, you will be wearing a removable denture, which you never wore before in your life, for 3 months. And I'm sorry to tell you that, but this is what it is. And this requires some coldness from your part, isn't it? This requires some, because I think this is almost as similar as to a doctor says, look, you've to someone that is close, look, you this patient, we couldn't save him. Right? And this is something really heavy. And if you play things in perspective, actually in dentistry, our life is much, much easier. But the thing is that we sell these dreams to patients like everything is perfect. Again, that thing that I used to tell, which is we are being very close to hairdressers and not as much as doctors, right? So people, they grab that promise that you gave them of fixed teeth, of beautiful smiles. You grab them, and it's like you are selling them an object, and then you don't deliver that object, which is something that I think that we need to place aside. I mean, you are treating people. People have unpredictable biology, and you also need to be aware of that whenever you are doing a treatment plan. So don't sell it as everything will ever be okay. Just you have to be honest with the person, but also you have to be able to tell them, look, this did not went well, and we are here to fix it. Of course, you will not be financially be. We are going to do a fair financial trade with you. Let's say it. So you'll not you won't be, how do you call it? In Portuguese, we say prejudicado. You won't be
losing money.
You won't be losing money. Exactly. Yeah. I think which is important. But we thought about going this way, but we'll have to go other way. And this is a dramatic case of dentistry that fails. But I think you have to tell them, especially when you do our surgical stuff. Yes, these things can go wrong. Like vertical bone augmentation, stuff like that. Yes, these things are risky stuff, and sometimes they can go wrong. And for me, that was the thing that hit me the most was like, we sold this to this guy as like a dream of fixed teeth in the same day, and now we are going back. We are going to reverse the quality of his life by using a denture, and that is going to affect his quality of life for 3 months. You have to place things in perspective. You have to tell them, look, this is what happened. This is not a big deal. It's not the end of the world, but yes, you'll have to go through this. I'm sorry to tell you. And it's difficult, right? But at some point, you also need to have some, like I told, some coldness, not only for the patient, but to yourself. Like, look, don't be a bitch. Me talking to myself, don't be a bitch, okay? So this is what happened. Don't make any drama. This is what's going on. It was not your fault, so just tell the guy the truth and let's move on. You have a podcast to record at 9 with Manuela, and you still have to have dinner before, and life goes on, isn't it?
You are absolutely true. And I say it again. There's a great danger when you take things in a personal way, when you associate that with personal failure, when you feel like you are being also failing as a professional, when something fails, when an implant fails, or when any other case fails. That's dangerous. And that can lead also for you to uncover the truth, right? So for you to like going for not for the most the treatment that should be done. Like you said, it's cold, it's blunt, but it is what it is, and I'm helping this person, and we have to go through this in order for us to achieve in the long term the best, what is the best for him. So, and again, we talked about this before, and it's the thing in dentistry where you have to of course have empathy, but you need to bring the action, and the action has to be always aligned with the best thing in the long term to help that person. Because if you are just thinking in hurting someone's feelings in the present moment, then that's just empathy, and that's going to be emotionally, it's going to drain you, and it's not going to serve that person well. And if you do a lot of that, then that can lead to empathy, emotional empathy, burnout, and it can also lead to you going for the easy fix that it's going to make the patient, okay, that's good, I'm happy you were able to solve it now, but it solves now, it doesn't solve
the problem
in the long term. And then it will reflect also on your work with complaints, etc., because it's going to fail. What you're going to do, the easy fix, it's going to fail. It's not going to, and the patient is going to be there 1 week after or 1 month after saying what you did is failing. So it's very important what you said, because it's not easy and requires some even some training, because I think that no one is taught.
It requires experience. It requires failures.
Yeah, that's it. Experience. It requires experience, but it's the right way to deal with these situations. And also, in the end of the day, you being able to, just like you said, to bring that awareness that it's not your fault. You did your best. It has a part that you cannot control. It's biology. We are dealing with human tissues. Let's understand also what failed, if something is going on here that provoked this, and to be able to detach yourself from that. It's very important. It's very important to always learn also with the situation, and to not take things personally. But another thing that I wanted to ask you, that I had here in my notes, is during the day, so during the afternoon, when you felt that you were in a stressful, unusual afternoon, just like you said, it's not your usual way of working, but sometimes it happens. How did you feel during the afternoon? Always
I felt
with 1 hour late. How were you able to notice, even physically? How were you?
I feel it, I think, in my shoulders. That's what I feel it. And I just felt, I think if it wasn't for this bad news of having lost 3 or 4 implants, I think the level of stress would just be like acceptable. It was just like you begin with an afternoon emergency, and then you, when you think you are not having a good day, the guy says that my lower bridge is getting loose. And I say, well, just come here and I'll just screw it. Sometimes it happens. But no, 3 of the implants got lost. So you were having this bad day, and all of a sudden it's like, right? So you are here, okay, it's late, you are 1 hour late. You have to tell this guy bad news. Your assistants will leave 1 hour late. And you have to deal with all that chaos, and you have to, I think there's a mix of, okay, one thing, yeah, I can do better than this. I need to organize myself better than this, number one. And there comes the nurses part, which is, okay, if they work longer, the system automatically pays them more. Okay, that's number one. Number two is, You have to reach to a point that you have to say to yourself, look, no matter what happens, I still need to find fulfilling and happiness in the moment, because at the end of the day, this is my life, right? I am living in this reality, right? So I have to take the best out of this, and I'm not going to ruin it myself more than the outside things that I cannot control. So whatever I can control, I'm going to do my best to be able to handle this and to be able to be happy and to be able to reach home and have a quiet meal and be with friends or something. So I think that you have to place things in perspective. You have to say, yes, this is happening, but I'm not going to let this ruin my day. You have to be aware of that. Yes. But that requires experience, of course. That requires that, first of all, that requires the system, again, that you have made some past errors and you want to fix them, and the system is there for you. And just the fact that you have this system mentality will also tell you that, look, yes, if something is not right and if it's fixable, I'm going to try to fix it. That's also another point. But to answer your question, is like a mix of, yes, the stress, you feel that in your shoulders, and then you just reach a point like, this is like the worst thing that has happened to me in the last it's like the worst thing that ever happened to me in a patient, which is true. I don't think I have such a disaster in a patient ever. I never had something like that, which is coincidence that it happened exactly in the day of the podcast of emotional awareness, right? So I think it's you have to, yes, not let that ruin your day, because you are living a day, right? And these things cannot be, they cannot take control of your emotions, and they cannot take control of you. Number two, you have to be able to see, well, what can I improve in the system to reduce the stress? And so if everyone knows they will get some extra money because they will leave an hour later, then also reduces the stress. And and then just realize that you have to be humble, and these things can happen, and you are human, right? And this is how you deal with it internally, I guess. This is, I'm not going to let this ruin my day. And I can do better. I can work for the systems to do better. And you need to be humble. I mean, this can happen. I mean, this is the way it is. You don't have to be Superman, right? This happened. It's not your fault. I know the patient may not like it, but
can you imagine living your days
like this? No,
like that?
No, disaster after disaster. No, no. Something was wrong. If we had this sort of failure rates, something was wrong.
Can you imagine living and working your days based on that feeling of stress, based on that feeling of heaviness on your shoulders, completely tense, with your muscles tense?
I think it affects,
completely locked.
I think what affects is my posture. I become less, and I become more. And I become
when we are relaxed, we automatically are more creative. We are automatically more connected. It's completely.
And I'm more direct. Sorry, I'm more direct with my assistants. Why? I always tell them thank you and please. Always, I always do that because this is my habit. But I'm more direct with them when I'm stressed.
When you are stressed,
I'm more. My tone of voice is like single tone, less careful, but there's always the please and the thank you there. At least it's not like they don't notice that I'm stressed, because they do. I think they do, but
probably.
No, I'm sure they do. But yeah, it's not something. It was impossible to live this way, and I think the trick for that is to delegate as much as possible. And also have a number of nurses that can reduce drama in the.
and not wanting to transform this in a psychotherapy.
Of course, no, I'm liking it. I'm liking it.
But
I need
can
that.
you?
I
Okay,
need
but
that.
I'm going. Can
I
you
need to do therapy
name?
for some other reasons, not probably for work, but
No.
I thank you
Can
for the
you? Can
free
you?
appointment.
Can you name the emotions? If I ask you to name some of the emotions that you went through this afternoon, for example, can you name it? I'm asking you this because it's very
Of
interesting. I
course.
didn't know if you already watched Brené Brown last in HBO. Last, it
No,
has 3 or 4 episodes.
no.
You should watch it. It's very interesting,
Okay, but
and
yeah.
it's a lot about emotion
Okay,
and
but let me
emotions.
see. Let me see, because I'm not very good with emotions, but let me see if I can come up with a word for what I felt. There was also one thing going on, which is one of the nurses, which she told me she was not going to get pregnant. She actually decided to get pregnant. And the thing is that I have 2 nurses. One of nurse, she was pregnant already. She was at home, and the other one that I additionally hired. I asked her, and I know this is different. This is a delicate subject as well. Which is, I told him, look, are you thinking about getting pregnant over the next 6 months? Because I'm not hiring you to substitute temporarily this nurse. I'm hiring you because I want you to keep you here in the long term. But look, are you thinking about getting pregnant in the next 6 months? And she said no. After 6 months, she said, look, I'm doing some appointments for fertility. And it's very delicate. It's extremely delicate subject. So what are the options here? The options would be I'll find another one, which is just to replace this one. So you say, okay, so 30% of my staff is pregnant, 30% of my staff is pregnant at home, and what you're going to do? It's very difficult, because what you have to see is this. I'm just trying to frame you what was also behind all that. So this last week I found this there, and over this last week I've been trying to get a new nurse, because I have decided not to renew the contract of this person that was planning to get pregnant, because she was on a 6-month contract and I was about to renew it to have it like a fixed term, and it was very difficult for me not to renew that for that. It was, and I did a meeting yesterday with all the team, and I explained them, look, this is something that I assume. I will do this. I will not renew her contract, because we have about 12 families that rely on us. And at the end of the day, especially with women, when we are having this conversation, this is you have to be extremely careful with this. It's not that I'm against the law. I'm not against the law, because it was a 6-month contract. And she was honest enough to tell me, look, I am thinking about getting pregnant, which is fine, because she could have not told me, and then I would have just to hold it there. And I thank her for that. But I told, look, I can't have you this. I can't have you here, because 60% of the staff at home pregnant, I had to close the practice. And it's about 10 to 15 families that rely on us, because it's all the other nurses, all the other doctors. And I cannot let your personal projects, which are very, very important, but I cannot let your personal projects not to ruin, but to completely condition the life of 12 or 15 families. Do you understand how hard this is? This is really hard, because no one especially a woman, when I talk about this to women, no one likes to hear this. I mean, oh, so because she's thinking about getting pregnant, you could not renew her contract. Yes, but I had another one pregnant. And this is really difficult, right? This is something that is really, and when the first things happened to me a few months ago, that I have a few stresses with my nurse and stuff like that, it really affected me for a few days, actually for a few weeks. This time when this affected me, I was surprisingly actually very unemotional, and I kept my good spirits throughout the whole process. And I'm very positive regarding the future still. And I had no doubt about the decision that I was about to make. I really had no doubt. But it is still something that you have to be aware that this triggers emotionally women. Not only women, but everybody. This triggers them. And this nurse, she's still working with us, and she's with good spirit, still working with us, and she's a good girl. But it's difficult, right? Because you have a person that you will not rehire her because her personal dreams, that she wants to fulfill her personal dreams, which is more than legitimate, of course, but you will not be able to have her in the team because of that. And this is, I think, from being an entrepreneur or having any sort of business, this is something that emotionally you have to be prepared for this stuff. You have to be, I don't know what's the long-term effect on myself, these sorts of decisions, because I'm not the same person, right? I am not the same person. Once you have to deal with these sorts of things from staff, and you have to make difficult decisions, ethical decisions, you can never be the same person again once you do them over and over and over, because it changes your core value. It changes your core emotions, right? You cannot avoid the feeling of some sort of guilty of doing this, right? And especially myself, because I want to get 90% of my staff stays with me. 95% of my staff, doctors and dentists, they stay with me. So it's I want to keep people from the long term. I don't like to make these decisions. So just to explain that, on top of all that stress, there was also this thing on the back of my mind throughout the whole week. Look, this is not something that I like, but I had to do this. And she is still here with me for the week, trying to fulfill her contract. And it's never comfortable for anyone, and especially the day after yesterday, which I did a Zoom meeting with all the team, and I told them, look, I'm going to assume responsibility for this decision. And I decided, because of that, I decided I would not renew her contract. And I know it's difficult. I know you don't like to hear this, but I had no choice at this point in time, because you either close the practice or you hire someone on a temporary basis, which is impossible today. Here in Portugal, it's almost impossible. So yes, you have to make sometimes these difficult decisions. Mm-hmm. So which means that sometimes, so what have I learned from this? What's the takeaway that I get from this? You always need to have an excess of staff. You always. And I have an excess of staff to accommodate one pregnant person, right? But I don't have an excess of staff to accommodate two pregnant persons. Or you can say, well, you can always hire men, which is kind of sexist, right? But all these things, they add up. And what was the emotion that I felt? On one hand, it was, I think there was some guilt over the last days. The emotion of feeling guilty or feeling feeling insensitive, feeling guilt and feeling insensitive. And then for the stress for today is like, I don't know if this is an emotion, but the stress from the from this day exactly of what happened today. I would consider that as pressure, I don't know if it is an emotion, but just pressure.